Hello, good afternoon, everybody. Thank you so much for joining in for today's session, which is on confidence and charisma, that is measuring impact of body language in communication. My name is Varun. I am the director of Hospital Success Team at Medland. Thank you so much for being so diligent and joining in on time for the session. Today, we are going to have a very exciting topic. We are going to discuss some nuances on body language and how it impacts your routine communication. I am super excited to take you all through some exciting, interesting facts about body language, how it impacts your regular routine, or not only in healthcare, but how it can also emphasize on your personal life, how you can improve your communication, how you can make it more efficient, more effective. So today we are going to see some facts which can help you involve in your communication, which can help you improve your communication skills. So before we go ahead, let's uh, have a brief overview about what Medland is, what we are, what we do, and then maybe we can start with the session. After that, we are going to have a Q&A. In that question answer round, you can ask me questions about how you are implementing these small exciting things about body language in your communication, how it has helped you improve. You can share experiences, and you can ask your questions based on the sessions. So I request Subhashri to kindly play the corporate video for us. Subhashri, am I audible clearly? Because I could see somebody messaging that it's not audible.
Yeah, I can hear you properly.
Okay, okay. So in case if anybody is unable to hear, kindly just adjust the audio because the audio is full from my end and the volume setting is also clear. So just look at quickly at your settings. Yeah, Subhashri.
Hospitals work round the clock to serve patients. Being at the center of the action, hospital physicians and staff must confront every situation and every challenge. They must also keep up with evolving health needs and knowledge through ongoing comprehensive training programs. What they need is a promising solution to ensure a continuous learning journey.
In today's world, technology is transforming life. Be it taxis, food delivery, everything we need is at our fingertips. Education is also going through a transformation, and we are at the forefront in the healthcare industry.
MedLearn is a comprehensive learning, training, and skill development platform incubated at Impelsys in India for healthcare professionals to attain the right mix of content, learning, and skills that help them throughout their career. The platform offers a wide variety of courses that enable hospitals to meet their employee training and development needs in areas of quality compliance, soft skills, and induction. The platform is designed in a way that it enables easy tracking of the real-time status of their learning progress. What's unique about this platform is that it's accessible anytime, anywhere, ensuring quality learning literally at your fingertips. Hospitals can now assign courses and track the competencies of users on specific topics with MedLearn's intelligent assessment tool, which gives them better administrative control. Its superior courseware helps hospitals provide standardized care and bridge skill gaps at every level in the organization. The healthcare professionals will also become more efficient and empowered when their learning journey progresses with ease and at their convenience. Let us unite to improve healthcare in India by spreading knowledge through technology. MedLearn, better prepared for better care.
Thank you, Subhashri. Perfect. So I guess we are good to go. I once again welcome each one of you in today's session. Today, we are going to understand how body language can impact your confidence and how body language adds up to your overall charismatic personality. Once again, thank you so much. I'm taking this training session for everyone present today. I'm a certified soft skills trainer and also an image consultant. So maybe I believe I'll be able to add into your knowledge and understanding of how important body language and non-verbal communication is. Also, I'm going to be taking some examples in context of healthcare. That as healthcare professionals, how can we implement all these concepts into our routine behavior to make our communication more effective and our personality charismatic? So before we go ahead, the way you carry yourself speaks volumes. And ladies and gentlemen, confidence is communicated not just in word, but each and every step you take, from your eye contact to your body language to what you speak, the tone you use, your postures, the way you walk, the way you sit, and the way you explain, the way you select your words, the choice of your words, the sentence framework. Each and every adds up to your overall personality, and that is why there is, you will see that people are accepting body language as a very powerful mode of communication. Reason being, your body is the canvas, your movements are the brush strokes, and paint a picture of confidence and sincerity in your communication. To make our communication more sincere, because we all are healthcare professionals, we are working in a very sensitive environment. So body language plays a very crucial role in the entire healthcare setting. So influencing communication, patient care, and overall quality of healthcare interaction. So there are several reasons why body language is extra important in healthcare. Of course, body language is important, but we have to pay a little more attention because we all are healthcare professionals. And why it is important? Because it helps you in building trust and rapport. Of course, patient is in an environment. Of course, we every day we work in the hospital, so the we are very well versed with the environment. But patients, they feel very strange with, they are afraid, they are very scared, they are totally new to their environment, and adding to the health concerns and the cost of care that they're gonna pay. Because of that, the patients get very anxious. So in order to develop that trust, to empathize with the patient, it is very important that we maintain a positive body language throughout. As healthcare professionals, positive body language such as eye contact, opening and welcoming gestures, starting from the entry of the patient till the exit, our body language should be in such a way that we are there to serve the patients. Our facial expressions, even your eye roll, your eye contact, whenever you're interacting with the patients, whenever you are counseling the patients, whenever you are giving the psychological support to the relatives, it's very important that in order to build that trust and rapport between the healthcare providers, between the patients and their relatives, it's important because trust is an essential for effective communication and develop that cooperation in healthcare. Another aspect to why it is important for all of us to learn the concept of body language, because it helps us enhance our overall communication. The non-verbal cues that we give during our communication process, it makes us more competent communicators. The way we provide additional information, it helps us to set the context. Healthcare professionals to better understand the patient concerns and to explain about the healthcare requirements, about the treatment guidelines, by understanding the emotional needs of the patients. This is especially important when language is the barrier and there is a cultural difference. Of course, I could see that now people travel across the states to get the medical treatment done. So they also, they are not even anxious because they are new to a healthcare facility. They are also anxious because they are away from their culture. So body language, a positive charismatic overall personality, will not only help you connect with the patient, will also help you improve and enhance your communication skills and develop your personality. Patient comfort and reassurance. So healthcare providers body language can convey that, okay, we are there for you, we are there to provide you the comfort, you are in safe hands. These cannot be just communicated with sheer words. You need to involve your body language, your postures which could comfort the patients, a reassuring smile that, okay, we are there for you, we are there to support you. Especially I understand when nurses are doing double duties, when doctors are providing treatment and care round the clock, the technicians, paramedical team, even the non-clinical team, we cannot ignore their efforts. Also the support staff from housekeeping, from the admin team to billing, admission, pharmacy, every single person contributes largely to the overall care of the patients. And that's why together we have to contribute to make healthcare such a efficient place to work, as well as such an efficient place for the patient to be able to rely on healthcare providers without any stress and anxiety. So conveying empathy and compassion. Empathy is a very intangible element actually. And to show that how compassionate we are, how much we want the patient to get well soon, how much we want the patient to be happy again, to get out of their miseries, we have to show our empathetic body language. Now, what is an empathetic body language? How do you ensure that you are a reflective listener? How will you project that you are actively listening? So that is why we need to understand the nuances of the communication. Other than that, interpersonal communication for facilitating understanding, to make somebody feel better using the visual aid, appropriate gestures, facial expression contributes to distribute the complex information into much simpler language. Professionalism and confidence. I have personally, over an experience of a decade into soft skills training, I have experience that people who positively use their body language while communicating with the patients or interpersonal communication, I have seen that they wear the confidence on the sleeves. They are much more confident, and the way they take their professional self is excellent. So if you want to develop your personality, take your personality to a completely new level, to a total different extent. If you want to design your own image, start working on your communication skills, especially the body language and non-verbal cues. Body language will also help you to manage difficult conversations. Sometimes it becomes awkward. Sometimes somebody is sharing very painful information with you. They're sharing their concerns. Patients are crying. Somebody's very angry. Somebody's giving you a negative feedback. All these difficult conversations can be handled very positively through body language, through your appropriate gestures, with your eye contact, with the facial expressions. The team communication, of course, a clear, respectful, non-verbal communication contributes a lot to a positive collaborative work environment and reducing miscommunication. I believe when you might have noticed and come across a lot of time that whenever you are sending a message, sometimes or an email, sometimes a person misunderstands the language that you have written. They misunderstands um, the message that you want to give. So in presence, when you are using your body language, your message becomes more creative, your message becomes more efficient, and your overall communication improves. So starting with the concepts of body language, before I go to the small specification that how will you identify just reading the body of the person, how will you sense the discomfort, how will you sense that there is a requirement of reassurance, that the rapport needs to be reestablished, when there is a reassurance to be reassurance is required, how will you read the body language of the person? At the same time, how will you ensure that your body is speaking a positive language? And there is a reason why there is a word language associated with body, because sometimes you do not have control over your body. Your body is so expressive that there is a word associated with language, that if there is a complete book, you might have come across a lot of books on body, understanding the body, reading between the lines, and understanding the non-verbal cues. So whenever you are reading the body language of a person, you have to take care of three things: change, context, and cluster. Number one is change. You have to, if you want to check the level of discomfort, if the person is not comfortable with what you are talking, if the person is not comfortable with the surrounding, if they are having a difficult time trusting you and the healthcare providers. Suppose there's a doctor who's giving a clinical counseling or guidelines to a patient, how will you ensure that whether the person is understanding it clearly or not? Whenever I'm communicating as a nurse or a non-medical team, or if I'm an HR professional, if I'm communicating the same to if I'm communicating some information to my employees, how will I ensure that they are understanding it correctly? I am able to communicate it efficiently. My personality is being taken by the person, in a more efficient way. I am communicating with all the professionalism maintained. How will you check all these points? So for that, you need to check 3C of communication. First of all, change. If there is a lot of change in the body language, if somebody is shaking their legs, they are rolling their eyes, their facial expression looks nervous, their body language is closed, so many changes happening in the body at the same time will make you conclude that okay, there is a sense of discomfort in the person, and I need to reassure, I need to develop that trust with the patient. Also check the context. Sometimes there are a lot of changes happening in the body of the person. Don't miss out on the context. Maybe the patient is discomfort, the patient is feeling lot uncomfortable because they are in pain. You cannot ignore the context. Sometimes you have to read between the lines, you have to hear what is unsaid, and that is what the concept of empathy is all about. And cluster, adding to what is verbally said, changes in the body language. What is the context? Maybe I have closed my hands, this is known as a closed body, a posture. I might be feeling cold, right? So that the context I cannot miss on. This is not a closed body language. I am just feeling cold, right? And the cluster. Cluster means clubbing. The context, the change in the body language will help you understand the person better, will help you read the person better. Starting with the first aspect of body language, this is my personal favorite, and you can implement it right now, immediately after this webinar. First is listing and labeling. So whenever you're talking to somebody, not only in the healthcare setup, anyone in your family, in your surrounding, with your friends, with your subordinates, with your seniors, with your juniors, with your even your kids, if you do apply this one trick, that is going to make you sound more effective, make your communication look fantastic. So first is listing. List the points you are going to tell. If you have noticed on emails, on WhatsApp messages, it is more readable, it is more legible when somebody talks in points. I remember in my childhood when I was to learn lengthy sentences, I need to mug up long answers from the social science. I used to make list. I used to make points. That helps me mug up those answers better. Similarly, when you are speaking to someone, I'm going to talk about 3 points. You remember the 4 points what we discussed? Today's discussion is going to be majorly on the 5 focus areas. So when you list down the things that you're talking about, it makes you sound more effective. Similarly, level. When you level up, level down things, it makes the person visualize what you are saying. I'll give you a small example. Suppose you are giving a vitamin dose to a patient. Suppose there are vitamin injections or a dietary recommendation that has been given to the patient. So today we are at 110 kgs, but slowly as you will start having the protein intake, fiber and vitamin in your diet, when you'll have a balanced diet, we'll calculate your BMI once again, and then we will remeasure your weight, and slowly we will progress to our ideal weight. So when you level up, level down, when you segment your discussion, it helps the person visualize more and makes your communication impeccable. Visual drop. Now, this is very effective in healthcare, especially I'll tell you, when a person is in distress and you're trying to explain something. Suppose I'm a relative of one of the patients and the patient is undergoing surgery. Now, the doctor is explaining the pros and cons of the surgery to me. the doctor is explaining the high risk areas of that particular surgery, I might not be in that present state of mind or in that present emotional state to understand the person completely. Or if as a healthcare professional, I did a faulty communication and my communication is not that clean, if you feel that you are making a lot of mistakes, you can visually rub it and you can say, okay, just forget what I'm saying. Okay, just forget what all I said. Let's start afresh. I will give you 3 points. Include visual rub, listing, and leveling. I'll club everything and I'll demonstrate. Suppose I was explaining to you about, I was explaining a patient about a particular surgery. I was explaining. I realized that the patient is not understanding it clearly. I will visually rub it that, okay, forget it. I'm feeling that you are finding it little complicated to understand. Just forget it, rub it, remove what all I said. Let's start with 3 points. Operative, pre-operative, post-operative. What are the pre-operative requirements? What all we are going to operate at the operation table? What are the post-operation specification? I divided into three. Now, this is what I did the listing. Now coming to leveling. Now leveling is, okay, through dialysis, we were able to manage the, patient body at this level. Now with surgical intervention, we are planning to progress at this level. And after a year, you can expect these changes in the body. So when you list, when you level, when you visually rub stuff, you will feel that the patient is able to understand. The patient relatives, even interpersonal communication becomes more effective. The next is shaping. You might have seen doctors whenever they are talking about a specific surgery, they try to make it more visually powerful. Whenever you are even explaining to your own kids, whenever you are speaking to elderly patients, it's good to make shapes and then explain. You might have seen mothers when they teach their children, they make shapes. If it is a ball, if it is a bat, if it is a square, if it is a circle, if it is a triangle, if we make shapes while speaking, it gives a little more impact to what you're trying to communicate, right? So suppose I'm writing a mail. So when you're writing a mail, I'm okay, just send me a mail. I'll speak to you over call. So what are these? These are shapes. I know that's a big no-no. People, when I'm saying no, but to make it more aggressive, to make it more sound powerful, I will say no, that's a big no-no. I do not smoke, I don't drink alcohol. But when you do thumbs up, okay, all the best, good luck, you will get well soon, I'll pray for you. So when you make shapes while speaking, it makes your communication more effective and visually powerful. Now, another point is prompting, and this is another one of my favorite. Prompting is doing something to make somebody mimic you, to make somebody. Prompt is just signaling the person that, okay, so many times I have seen that when a person asks everybody to clap, the first thing they themselves do is clap themselves. When I will clap, I will make others clap. So when I'm like, oh, why are you sad? Just smile. When I'm saying this and keeping a smile on my face, it will prompt the other person to bring a smile on his or her own face as well. When in a group conference, whenever I'm sitting on a round table, whenever I'm sitting in an HOD meeting, I want to get a quick public opinion on what everybody feels. If I want to ask a poll, the first thing I'll do is I will give my own suggestion that, okay, I believe this should be done. What do you think? So when you yourself prompt the person looking at you, they will also do the same. And that is why in empathetic communication, we focus a lot on how your emotional state is, how your emotional well-being is all about. So when I will look sad in front of the patient, it will not help the patient to recover faster. It will not help the patient to get that psychological support from you. If you are smiling, if you are all cheered up, if you are all boosting and motivating the patient, that will help them recover much faster. That will help them trust you better. That will help them rely on you for their, care needs. They will be able to speak to you clearly if they need something or if they have any concerns. So prompting is very effective. Again, when you smile, even if I'm at the billing desk, I have seen people do not make eye contact. They are so much busy. There are a lot of patients on the counter. Just give a visual glance to all those who are standing on the counter. They will feel acknowledged. They will feel prompted that, okay, you have looked at them. That means you know that they are there and you are going to address their concerns, or you are going to take up their queries. So ensure that you are smiling. You have seen that yawning is another interesting. I don't know what is the science behind it. If I am yawning and if somebody sees me yawn, they will also yawn. If you watch somebody yawning, you will also feel like yawning, right? So what is it? Somebody's yawning prompts you to do the same. Similarly, when you put in intentional efforts to prompt a body language, it will make the person involved in the communication. It will make the interesting interaction super successful. Stipple fingers show extreme confidence. If you might have seen good speakers, if you might have seen the autobiographies of various leaders, they always stand or sit with stippled fingers. So when you want to express extreme level of confidence, when you want to project your personality really confident, you can stipple your fingers while sitting, while standing. That will make you look more professional. It will make your personality look more powerful. It will help you design your own impression in the eyes of that person. So stipple fingers. Even I have noticed a lot of YouTubers these days, they stipple fingers when they talk. Very good speakers across the globe, they stipple fingers. Motivational speakers. Even I have seen a lot of doctors when they are counseling the patient and they want to generate that confidence. Again, prompting. They want to prompt that the confidence that you will get well soon. The similar confidence I want to develop in you. So I will stipple fingers. And when I'm speaking, I'll speak in such a way that you will also feel confident that, okay, I can trust this doctor, I can trust this nurse to take care of my patient, to take care of me. Hand envelope. Especially service excellence people, front office team, patient coordinators, IPD coordinators, OPD coordinators, or let's say floor managers, any person who is on the floor and measuring the patient experience, who are guest relation officers, who are in the guest relation team, they need to ensure the way they are standing. Even the nurses especially, please note, whenever you are not working and you are just standing at the nursing station, the way you stand also, the way, where do you keep your hands when you stand? The moment it comes on the table, you feel like leaning, your body posture gets disturbed. So the best part, if you want to stand still and still look confident, if you are in a seminar, if you are in a conference, if you are standing in front of the patient, if the doctor is giving the consultation, and if you are just standing beside the doctor to understand what is the treatment and care plan, what you can do is you can just make a hand envelope and stand. Hand envelope makes your shoulder stay broad and make your personality look confident. Arms akimbo. So these all are tested psychologically researched body language tips, which I'm going to give you. So please remember that all these body language are taken from some expert books. Even I was researching. I'm a clinical psychologist, so I have been researching a lot on understanding the body language. These are few of the many fantastic tips which I have got through all my research, and that's why I'm presenting it in front of you all today. So arms akimbo, that means whenever you keep your arms or palms on your waist, it looks like a very aggressive posture, makes you look more territorial, makes the person feel anxious, makes you look more authoritative and dominant. So please remember, if you have the habit of standing like this, it might make you look aggressive. When a person is not speaking to you, your overall body language can be judged wrong. So please remember, arms akimbo, this type of body language you need to avoid. Full hand gestures. If somebody is using their full hand to communicate something, it could be patient relative, or anybody you meet randomly outside. You might have seen people using their full arm to express something. The full arm movement shows that they are trying to take over the control over the conversation, over you, or over that particular situation. So when from the wrist, to elbow to the entire arm. When the full hand is involved in making the gestures, that means the person is intentionally trying to take over the control of the situation. That's why you might have noticed when in hospital or any segment, people when they become aggressive, they start using their body language more rigorously. Their body language become more aggressive. How will you ensure that? How will you check that the body language is aggressive? Just by measuring these small details, measure understanding these nuances. When there's a full arm involved, that means they're moving towards aggression. They are trying to take over the control over the situation. Now, hand on the chin. You might have seen a lot of people when they are listening to you, they put their hand on the chin. That's nothing but they require validation. They might not be very sure about what you are speaking. They might not be very clear about whether the information is authentic or not. They need more credibility. And that is why when somebody puts the hand on the chin, you might have noticed that when we were kids in the classroom, we used to, if we have a doubt, we'll immediately put our hand on the chin. So remember, whenever you're speaking to somebody, if the hand goes on the chin, that means you need to validate what you are saying. You need to give a proof of what you are saying. Give them a research point, give them a fact or a statistics, or give them a document evidence to make yourself sound more credible. Hands on the ear. This is very normal that whenever we are having an interaction with somebody, you might have seen people touching their ear. That means they are done listening. They want to speak now. So you need to identify these small clues, some small hidden cues in the body language, which will help you structure, redesign, reframe your communication and your conversation to sound more credible, to sound more effective, to sound more crisp. Crisp communication is something which I feel like is lacking in a lot of people, because sometimes we over-inform, which we call it TMI, that is too much information. Sometimes we under-inform. In spite we want to communicate something, we end up communicating something else. So there are a lot of faulty communications we come across in our routine, right? So address those communication gap. Let's identify the small communication non-verbal cues to structure and design our communications accordingly. Handshakes. Sometimes people just keep their hand dead while they are shaking their hands, right? So if you feel that a person has a loose handshake, that means they are not very reliable, they are underconfident. Now, that might not be intentional. Suppose I'm very tired, I don't want to shake hands. So I just had a very dead handshake with the person, like a dead fish, because I was tired. That's why in the beginning of this session, we have understood the 3C of communication. That don't judge the person just basis on the handshake. You have to, identify the non-verbal cues of their overall personality. So don't judge any person immediately as soon as you observe something in their body language. Try to understand their tone, the choice of word they are using, the way they are standing, the way they are sitting, the way they are communicating, the tone they are using, the volume in which they are speaking, the speed of communication that they are maintaining. Club all this as a cluster and then only use your assumption and use your instinct. Tight handshake. Usually you have seen a lot of politicians having a tight handshake signaling dominance. Also, if you have seen many leaders, they hand hug, which shows honesty, trust, and it is also known as a politician's handshake. People usually hug hands to show that trust, that dependence. Territorial handshake. You might have seen that a lot of people have their habit to keep the hand more towards them when they are shaking handshake. That means that the person is trying to threaten you, that the person is trying to increase the territory, that okay, I am somewhere at a bigger authority than you. I am dominating. Okay, that the person is trying to make you feel insecure. Face touch. I mean, I have personally observed a lot of people touching their face, their hair while they are speaking, which is not a very good sign in communication, because it makes you look more anxious. You're incomplete. Your communication is not complete. You are thinking and then you are speaking. or whatever you are thinking, you might not be speaking exactly that same way. The person gets confused when you keep on touching your face while communication, so avoid that. Next, scratch. So of course, with different cultures, the understanding of a particular body language cue may vary. But sometimes a person is scratching the neck. That means they want to disagree, but they are not disagreeing. Not every time people will be verbally disagreeing with you. They might signal that, I don't agree to it, but I don't want to say it. That time, you need to prompt them to speak their heart out on what exactly they know, what exactly they are understanding, so that you can clear things out. Forehead touching. If somebody is touching the forehead while speaking, that means they require comfort from you. The trust rapport that you developed, the trust frame that you developed at the starting of the communication has been lost, and you need to re-establish the rapport. Now, emotional gestures, we sometimes end up using a lot of emotional gestures. Like, for example, when you're angry, you make anger emotional gestures. When you're very happy, a person can just look at you and tell that, okay, this person looks very happy. Oh, that person looks very sad. That person looks very cunning and clever. How are you able to identify these attributes in the personality without even talking to that person? The reason is these are known as emotional gestures. And please, ladies and gentlemen, remember, whenever you are emotional, whenever you are under stress, avoid using emotional gestures at that particular time. If I'm aggressive, if I'm shouting at somebody in a glass room where there is no sound, looking at me, you'll be able to understand what level of anger I am at. From 1 to 10, what scale of anger I am at. So please remember, when you are very happy, very sad, very angry, aggressive, upset about something, disappointed, don't use those emotional gestures. Now, situational gestures, like there is a traffic, you might have seen people getting all frustrated. They will show frustration with their hands. Once upon a time, if they are telling you some or the story, oh, it was long back. So the way they say it, with the way they show the timeline, that is to make you understand better. Now, there are certain emblems that you use. Now, what are these emblems? These emblems are nothing but the gestures with the help of which we replace the word. So if I have to make somebody not just silent, I want the person to be quiet, I will just put a finger on my lip, and I need not have to say something. That person will understand that what I'm trying to imply. So when I'll say, oh, this is very good. If somebody is signaling me that, oh, how am I looking good? And I'll say, oh, you're looking very good, right? So these gestures, so in French, it is oh, so it varies religion to religion. It varies culture to culture, cities, states. So these body languages might change. The interpretation of these body languages might change. So emblems are nothing but the replacements, the gestural replacement of those words. Postures. So the first is matching and mirroring. If you can see on the screen, if there is a strong rapport already established, you will see that two people, they are mimicking their body language. Two people, two members, when they are speaking, either could be a patient or staff. It could be a staff to another staff member. It could be the patient to the relative or anybody. You will see the rapport has been established such strong that they end up matching and mirroring each other subconsciously without any intention. It automatically happens because the rapport has been developed so strong that they are prompted to do whatever you are doing. Sitting postures. Whenever you are sitting, please remember there is two ways of sitting: Cambridge cross and gentleman's posture. So this came from Queen Victoria's family. When the females they want to know that how a professional posture for sitting is, they just need to cross their legs, push it a little, and then the back, and put both of your hands on your thigh. It will keep your torso look more confident. Whenever you're speaking, it will make you more alert. It will keep you more focused. Similarly, for boys, your shoulder joint, your elbow joint, and your ankle, your knee, all should be in one straight line whenever you're sitting, keeping your spine straight. Whenever you're speaking, whenever you want to sit professionally, These are the two postures both male and female members can use. High power poses and low power poses. Whenever you are keeping hands on the table, keeping hands on your waist, when you are leaning too much, when you are leaning more towards the table, you will see these are high power poses. Either you are showing that you are not interested, or you are agreeing in you are disagreeing in a very aggressive manner. So these high power poses are not recommended because it's a big no-no. You have to avoid these high power poses. It will intimidate the patient, make you look more dominant. It will make your communication faulty. Low power poses, when you are sitting very close, when you are sitting very, in a very compact way, when you are looking down while speaking to the patient, when you have no facial expression while talking, that shows the lack of power. Okay, the lack of power, not in hierarchy, not in a hierarchical way. The lack of power in terms of your personality, that you lack confidence, that you lack the overall charisma. Types of eye contact in a corporate setup, in a professional environment. So whenever somebody is looking at you and above your eyes, that person is giving you a business case, wants to keep things utter professional, wants to talk only things which are related to work, related to office, related to patients. When somebody is looking to your face, to your eyes till your chin, they look entire on your face. They're giving you social gaze. That means they are okay to connect with you beyond work. That means they are okay. They are comfortable with you being around. They want to be friendly. They want to express that they appreciate the conversation that you are having with them, and they are okay to talk anything off topic as well, off related to work as well. But somebody is looking down on you beyond chin, it is giving, the person is giving you intimate gaze. That means the person is wanting to associate at a different level of comfort. The person, now when I say different level of comfort, don't misunderstand it. What I mean is they are okay to share anything with you. They are okay to discuss anything with you. Again, I will bring that thing, that just on the basis of eye contact, you should not make your judgment. Use your instinct. Follow the 3C, that is cluster, context, and change. Not, you cannot judge the person basis on their eye contact. You need to trace the overall cues in the personality and then reach to a conclusion on what you understand from the person's personality. Angular distancing. Angular distancing is nothing but when you lean, when you are understanding the person, you lean a little forward when the person is saying something, right? So that means your angle is in such a way that you are making the person feel that you are listening to them, you are understanding what they are saying. Cloth manipulation. If the person is trying to adjust their clothes, if the person is again and again they are touching their clothes, that means nothing but they need more assurance. Uh, they need more credibility. They are uncomfortable. Either it could be change in setting, it could be a change in the environment, it could be change in the context. The person need change in the way you are speaking, the person need change in the environment. So we need to identify these cues. Again, cluster context is very much important. Men spreading, that is knee resting on the knee, ankle resting on the knee. So ready to be challenged, the person is in composure. This is again a high power pose which you should avoid. These high power poses are nothing but makes the person feel uncomfortable. The other person might be reluctant in speaking to you. So we must avoid this particular posture, especially in a professional set. Claps the hand. When the person is very fearful, anxious, you might have seen people when you are expecting something, when you are really nervous, you claps your hands. So please remember that avoid clapping hands when you are speaking something to the patient, when you're interacting, you want to express confidence. You should not clap your hand. Keep your fingers stippled. That's a high power confidence posture. Body support. Body support, wall support, they are touching the door, relying on the furniture during the conversation. It's create confusion in the conversation, whether the person wants to relax, the person is bored, the person is more casual. It makes you it makes his little it makes his uh, little challenging for the person to understand uh, in what current mood you are at, right? So it makes the person feel uncomfortable. So don't lean on wall, door, furniture, on the desk, because it will make the communication faulty. So here comes the end of our today's discussion. This was the first version of confidence and charisma, the impact of body language. We went through some tips. We understood what are the few non-verbal communication cues that you can identify and even correct in your own personality. The body is an unerring truth teller. Pay attention to what it's saying, even when the words are silent. So I believe that I was able to add something in your understanding and knowledge of how important nonverbal communication is. I wish you all a very happy experience with MedLearn. Thank you so much once again for joining this session. I really appreciate everybody taking out time. Festive season is on, but still you are giving importance to learning. I really appreciate that. I personally get motivated from such good participation. So thank you all once again for being such wonderful audience. I would be opening the forum for question and answers. Any question answers, anything that you would like to ask, anything you would like to suggest, anything you would like to share. It could be your experience as well, or anything if you feel that you might have faced in recent times interacting with a patient, interacting with any of your subordinates. Feel free to drop in the chat box. You can put your queries in the chat box, and I would be happy to address. So I have a question. If conversation is going towards heated argument between doctor and patient, how does body language impact that? Okay, so first of all, there should not be any heated argument between doctor and patient. uh, in a healthcare setup, no healthcare professional can afford to have a heated argument with the patient. Please remember that do not try to match the tone of the patient. The patient sometimes will be very abusive also. The patient sometimes is going to be hyper aggressive. The patient relative can be a lot disrespectful also. You need to ensure that you cannot match the tone. You have to maintain your composure, especially as a doctor. You cannot do that because the patient is in a very different mental state. The patient is in a very different mindset, and we can only imagine the pain, the financial distress it takes to get the healthcare, to enter into a hospital. Many people panic. So I would strongly recommend that avoid any heated argument as a sound healthcare professional. But in case somebody is getting aggressive on you, but you are maintaining composure, but the tone is going to a level of disrespect. Use your body language to tame down the person. That's a relax. I understand. When you're saying I understand, don't worry. We are there to support. I hear you. I understand your problem. Please give me some time. I am there. My team is there. I will come to you. I understood. I heard you. So when you use your body language to make it more, visually powerful, the person will tame down. And this is my guarantee that if somebody, not only in patient setting, in your personal life also, if you are having a heated argument with your family members, with your friends, with your colleagues, with anybody in neighborhood, try this. If somebody is being aggressive, even on the roads, if people hit each other and there's a heated argument, if they the moment they match each other's tone, the matter is not going to solve. If somebody is taming down, if somebody is making the person feel that it's okay, it happens slowly and gradually, they will tame down. Okay, can you give more details about angular distancing? Okay, so angular distancing is nothing but your angles when you are speaking to the person. So suppose I am listening to you, and all of a sudden heard something which of my interest, I will lean towards you. I said, okay, yeah, I'll try to listen to you more carefully, right? And whenever I'm listening or whenever I'm speaking, my angles keeps on changing. Now, based on my inclination, based on understanding, I will change my poses and I will maintain distance with the person. Suppose there is a table in between. I will use the table as a prop, and I will, try to communicate through my body language. So whenever a person is distancing himself again and again, himself or herself, they are using a lot of body angles. That means they are having multiple thoughts in their minds. So you need to help those thoughts get clarified in front of the table, discuss. It will make the communication more effective. I could see a lot of raised hands. I request everybody to kindly mention your queries in the comment section. You can just quickly type in the chat box. I would be happy to address those queries. I could see Prakriti, Sharol, Prithvi, Esther, Prashul, Seemavati, Nikita, Kavita. Can you please put your queries in the comment section? Hello. Okay, if you're unable to do so, let me unmute. Hi, Prakriti, I have unmuted you. You can go ahead with your query. Sharol, I have unmuted you as well. You can go ahead with your query. Esther, you can go ahead and ask your question. Prithvi, you can go ahead and ask your question. Prashul, I have unmuted you as well. You can ask your query. Seemavati, I have enabled your mic. Nikita, I have enabled your mic. Kavita, I have enabled your mic. So all those who raised their hands, I enabled your mic, so you can go ahead. Okay, I have another question on um, angular distancing. Okay, 1 second. Okay, so angular distancing is to understand uh, the when a person changes the angle. What is angular distancing? Angular distancing is nothing but mixing the concept of angle and the distance. Wherever you feel when a person is inclined, when a person is not maintaining the eye contact, the person is intentionally maintaining distance while interacting. Somebody you might have seen, especially when we're very close people, when they talk, right? So they tilt their head while listening to them. When something very interesting going on, you change the angle of your head. Sometimes if I have a disagreement, but if I'm not speaking, right, so I will make my body more distant. So I'm sitting here, there's a table in between, but I will become more distant, right? So I'm changing my body angle. Sometimes you might have seen that if a person is talking and I am sitting in such a way that my shoulder is in front and my chest is towards the other end, right? So these changes in distance shows that there are a lot of thoughts going in the person's head. Now, these thoughts are not necessarily in sync with what you are talking. That means you need to reestablish the rapport and talk in such a context that you and the other person comes on the same page. That's what angular distancing is. Any other questions? Anybody would like to ask? Okay, can you suggest few activities that could be conducted during body language training? Very good question. So, of course, one thing which I used to personally involve in my training program was role plays and case study. Case study is, suppose I'm taking a training as a trainer, as a nurse educator, as an HOD. Give them a condition that suppose you are at the front office, suppose there are 9 members standing in front of you. You are getting a call parallelly as well. Now there is a patient who are 9 patients altogether. Out of 9 patients, 4 are very aggressive. All the 9 queries are important. The call is also important because you are getting ambulance calls, you are getting appointment calls, you are getting simple query calls. What will you attend first and how will you manage the chaos? This is the situation based role play. Now, may bring 2 people, 2 nurses, doctor, patient. They can role play. Give them certain, task that okay, this is a nurse. Now this patient is crying. The patient wants to go home. The age of the patient is 12 year old. The patient is a 12-year-old kid. Now, how this nurse will counsel the patient with the help of effective body language that, okay, don't worry, I'm like your sister. See, there are other children also. There was a baby just before you. It got discharged because he was eating on time, taking medicines on time. If I'll use my finger, if I'll make my eye contacts, eyes look more intimidating, the patient will lose the rapport. So do role plays. Case study based trainings are very effective when you are giving soft skills training to um, the staff members. What parameters could be considered to measure the staff body language during conversation with the patient? I request all HODs to have at least a grooming or a checklist of effective communication, whether they were able to explain, whether they were able to explain all the policies, all the protocols were, explained on time. All these things need to include, right? So I guess direct observation can really help how better people are applying this body language concept in their routine. Kushi, you have a question? You can go ahead. Okay. So I believe there are no more questions. In case there are after the webinar, you can get in touch with me through LinkedIn. You can follow Medlearn on LinkedIn. If for any other query, info@medlearn.com, you can reach out to us. If you are a Medlearn member already, you are going to have these sessions on frequent basis, industry specific expert webinars we keep on conducting. And if you are not a Medlearn member, you can book your demonstration on our LinkedIn page. You can reach out to us directly on LinkedIn, on our website. Thank you so much for your support, for your cooperation, and being fantastic questions and being a fantastic audience. We look forward to have similar interactions with you all in near future. And I wish you all a very happy festive season ahead and a wonderful evening. Thank you so much.